Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. More states in Nigeria receive and roll out the Oxford AstraZeneca vaccines. And despite efficacy of COVID-19 vaccine, a recent report by the Africa Center for Disease Control shows significant proportion across the continent express concerns around vaccine safety. And Kenya's government warns of a third wave of COVID-19 infections. Data from the Nigeria Center for Disease Control (NCDC) reveals high recovery rates in the country since the beginning of the week. The center announced 927 new recoveries last night, making it the highest number of patients discharged in the week, a rise from Tuesday's figure of 554 recoveries. The country's total recovery tally currently stands at 139,983. The center also recorded the highest single-day count since the beginning of the week, with 394 new infections, a rise from yesterday's figure of 346, bringing the total number of confirmed cases to over 159,000. However, the agency said Wednesday's report includes data from Taraba State that was recorded over the last 2 days. The 394 new cases are reported from 18 states, with Bauchi State recording the highest number of new infections, 75 positive samples, followed by Lagos, which had 36, and closely followed by Akwa Ibom, with 33 cases. The agency also reported 5 new deaths in 36 states, and the FCT increasing the fatality toll to 1,993. And with more states receiving their share of the COVID-19 vaccines, we begin in the northern part of the country where Kebbi, Sokoto, Zamfara and Gombe states took delivery of the Oxford AstraZeneca vaccine at the Sultan Abubakar III International Airport, Sokoto. Various state representatives were on hand to receive the batches for onward delivery to their various states. Meanwhile, the Plateau State government received 105,600 doses of the COVID-19 vaccine, which is the first batch in the series of vaccines for the state. Inspecting the consignment at the cold room in Jos, the secretary to the state government, Professor Dan Ladi Atu, in company of the State Commissioner of Health and WHO representatives in the state, took a tour of where the vaccines will be preserved.
Yes, I can officially now confirm to you that Plateau State government have received our own version of the COVID-19 vaccine doses, amounting to about over 105,000 doses for the first phase. I can equally assure you too that Plateau State and our technical team, they are prepared for this. They have done quite a number of trainings, and we hope that as soon as they finalize all the other aspects of training, they will commence the vaccination. Probably next week, I'm sure this week, we want to use it to mop up all the trainings. There are other preparations. It's not about this one here. They have arrived, yes. But people who use it, we need to make sure that they are well trained, they are well equipped, so for the commencement of this. So we're working around the clock to ensure that we finalize all aspects of training and preparations to that effect.
In a state, the government took delivery of over 100,000 doses of the vaccines from the federal government. The executive secretary of the state's primary healthcare development agency and other subordinating staff of the agency, along with top government officials, received the vaccines Wednesday night. Well, over to the south, the Cross River State government received over 50,000 doses of the AstraZeneca COVID-19 vaccines to start vaccination across the 18 local government areas of the state. Confirming their arrival, the State Commissioner for Health says the vaccines were received in good state alongside other medical accessories needed for vaccination.
We have a little over 50,000 vaccines that arrived, and they came with all the commodities which we need, the injection syringe and other medical commodities that we would be requiring to deliver these vaccines to our people. the vaccines arrived in very good, potent state. So all the health workers in Cross River State would be given the vaccines. And then when we refer to strategic leaders, we are referring to leaders that can influence other people to take these vaccines. So the governor of the state, the deputy governor, the speaker who was here to receive the vaccines himself, myself, the DG Primary Health Care, other leaders that can influence others to take.
In the meantime, Delta State government received over 80,000 doses of the vaccine, while frontline health workers will be the first to be vaccinated, followed by the governor and other officials, which are to begin Friday, the 12th of March.
We received 85,700 doses of the COVID-19 vaccine, and this marks the beginning of the statewide vaccination exercise. All this while, the State Primary Healthcare Development Agency, whose chairman and ED are here, have been planning tirelessly to see that the state has an effective and efficient statewide vaccination for this COVID-19. Beginning with health workers, especially those in the treatment centers and other health workers. Those are the first ones who will be. Then thereafter.
Well, the government of Akwa Ibom State took delivery of 69,030 doses late last night. According to the Commissioner for Health, he assures that the cold chain facility is adequate to preserve the doses, while frontline health workers will be prioritized. Further plans for vaccination will be announced in due course. Well, let's take you to the southeast. The Imo State government has taken delivery of the first batch of the Oxford AstraZeneca COVID-19 vaccines from the federal government, with a total of 80,720 doses. Our correspondent, Ekiti, has more.
The Oxford AstraZeneca vaccine arrived in the Sam Mbakwe airport at about 10 minutes after 6 p.m. on Thursday, 10th March 2020. The Imo State Commissioner for Health, Damaris Osunkwo, and the Executive Secretary of the Imo State Primary Health Care Development Agency, Maria Uzoma, alongside officials of the WHO and UNICEF in Imo State, are all present at the airport to receive the vaccines. One after another, the boxes containing the vaccines are rolled into the cart for onward movement to the storage facility put in place by the state government. While confirming receipt of the vaccines, the State Commissioner for Health, Damaris Osunkwo, dispels negativity rumors about the vaccines.
COVID-19 disease is real and it's killing Nigerians. So scientists have gone out to produce vaccine that will help us to fight this disease. I know that you know about other vaccines like BCG. These are rumors that came out even during that time. So rumors were about to come. But we are the people, the doctors, telling them that this is not true. This vaccine is going to help them fight this disease.
On the effective administration of the vaccine, especially at the grassroots, the Executive Secretary of the State Primary Health Care Development Agency, Maria Uzoma, says all modalities are in place in the 27 local government areas of the state.
First of all, we do it first for the frontliners, for the health workers, the military, as the Honorable Commissioner said. Then this is the first phase. It has to run into 4 phases. After this one, we expect the second phase, and gradually we will reach every Imolite.
According to the Commissioner for Health, the flag off for the administration of these vaccines has been slated for Friday, 12th March 2020, with hopes that the governor and other top government functionaries alongside frontline health workers will take their jabs. Eyi Tokwe Kuteyi for COVID-19 update.
Meanwhile, the Ebonyi State Governor has gotten his first shot of the COVID-19 vaccine. The government received its allocation last night, and to demonstrate the importance for the people of Ebonyi State to get vaccinated, the governor, Dave Umahi, as well as his deputy, Eric Igwe, received their jabs to dispel any doubts as to its safety. Isaac Pauzo today received his first jab of the coronavirus Oxford AstraZeneca vaccine. The governor was also vaccinated alongside some other top government officials at the Government House. Umuahia. While in Kano, the governor, Abdullahi Ganduje, was vaccinated for COVID-19 at the Murtala Mohammed Specialist Hospital. Kano was administered to him by his personal physician in the presence of some members of the State Executive Council, among other critical stakeholders. Now, the governor of Ekiti State, Dr. Kaide Fahimi, flagged off the state's COVID-19 vaccination exercise in the state capital, Ado Ekiti. Our correspondent, Babajide Agbeyo, captured the moment.
Nigerians Governors Forum and the governor of Ekiti State, Dr. Kaide Fahimi, joins the list of top-placed Nigerians who have received the COVID-19 vaccine. His wife, top government functionaries, and some frontline health workers also toed the same path.
I've just taken my own first jab of the vaccine, along with some members of the State Executive Council and citizens of Ekiti, to affirm to you all that the vaccines are safe.
For the governor, this action should trigger believability on the part of citizens, and they are expected to also follow suit.
I can assure you all that we will ensure vaccines are available to everyone in Ekiti.
The lead has been taken, but the governor is still advising citizens to maintain existing COVID-19 protocols. Babajide Agbeyo for COVID-19 update.
Thank you, Babajide, for that. The Ekiti State Commissioner for Health, Dr. Oyebanji Filani, joins us now via Zoom. Welcome to the program. Let's begin. The Ekiti State Ministry of Health, you've recently directed that all medical facilities, government and private, conduct COVID-19 tests on any patient with cough, cold, fever-related symptoms before treatment. Now, is that working or being adhered to, and will it continue with the arrival of the vaccine?
Well, first and foremost, thank you for having me on the show, and I've quite enjoyed your coverage of the COVID-19 vaccine across the states. Earlier this year, at the beginning of the year, we made the decision to ensure that everybody who meets the case definition for COVID is tested, whether in a private sector facility or even in the public sector facility. And this was important because we wanted to be sure that people were not treating malaria wrongly, whereas patients probably had COVID. I think that has worked very well. Between January and now, we've tested just about 90% of our total testing that we did between March 2020 and December 2020. What that means is that we've aggressively scaled up our testing capacity because we have more facilities who are testing. And the idea behind that is to ensure that we can catch it very early, identify and diagnose it very early, and ensure that people are able to receive adequate care. In Ekiti, the testing and also the treatment has always been free, and we have to appreciate His Excellency for that. With respect to the question around will that continue, most certainly, the vaccines have come. It will take some time to ensure that we get it to everybody because of the limited doses that have come in the first instance. But we would maximize this current dose across our healthcare workers and ensure that we have our strategic leaders and our frontline workers across the state are able to receive these vaccines. Thank you.
Finally, some religious institutions and other groups appear to be opposed to receiving the vaccines. What are the plans to reaching out to them?
So I think the first thing to say here is that, and it's perhaps it's still anecdotal, but the impression we have, or the sort of like warm reception we have within Ekiti to receiving the vaccine in the last 24 hours has been really great. And we would hope that we can build on that momentum. Just last week, I'd spoken to a couple of our religious leaders on multiple sides, the Christians and the Muslims, and they've all indicated, the ones I've spoken to so far have indicated their interest not just to collect it, but also to show it publicly. We recognize that, there are different stakeholders, and the religious leaders are such an important stakeholders. If they do come out and take these vaccines publicly, we believe that would have a lot more people who feel more comfortable and confident. That said, that we've reached out to 1 or 2 or 3 or 4 does not mean that we will not continue to do that. People who have genuine concerns will continue to engage with them, and we hope that we can bring even more people into the fold.
All right, we'll continue to watch the developments. We'd like to thank you, Commissioner for Health, Ekiti State, Dr. Ebanji Filani. Thank you for joining us on the program.
Thank you for having me.
Despite more positive perceptions of the importance of efficacy of the COVID-19 vaccine, a significant proportion across the continent expressed concerns around vaccine safety. According to the Africa Center for Disease Control, across most of the African countries surveyed, 15 of them, respondents tend to view new COVID-19 vaccines as less safe than vaccinations in general. In certain countries which were looked at, Ethiopia is one of the few countries where respondents do not believe that a COVID-19 vaccine is less safe than general vaccinations. 60% of those who would reject the vaccine believe that it would not be safe, compared to just 16% among those who would accept it. Specific demographic and attitudinal groups show high levels of skepticism towards the COVID-19 vaccine. Well, to look at this, joining us from our Abuja studio is Dr. Ejike Orji, Chairman, Medical Subcommittee of the FCT's Ministerial Expert Advisory Committee on COVID-19. He joins us from our Abuja studios. Thank you for joining us on the program.
Thank you, Millicent.
Let's begin. Do you think that the rise of new variants will underscore the vaccination efforts, which have only just begun in Nigeria? A lot of people around the world, especially the reports from Africa, are really wondering, and this is affecting their vaccination hesitancy, if the vaccines protect against the SARS-CoV-2 variant.
Yes, well, there will always be people who will be a bit more worried about what's going on. But if you look at the data coming out from other countries, especially from England, and then all the work that have been done, there's no proof that the new variants, this vaccine will not be able to help ameliorate the deleterious consequences that it poses occasionally. What we have seen also, and then what has been reported, is that most of the people who felt that the vaccines won't work, they are looking at the age group. But all the information coming out shows that the vaccine is reducing hospital admissions, seriousness of diseases over the whole world where it's been administered. I do know that even the organization that manufactures it, the company is also trying to recalibrate to be able to meet these new variants that are coming out if they find out that something that is not meeting the desired goals. But so far, there hasn't been any concrete proof that it will not help ameliorate the deleterious effects of this pandemic.
How do you think the COVID-19 vaccine compares to the other vaccines? I'm talking maybe about the Oxford AstraZeneca, and I mean other vaccinations, because we have the reports from the Africa Centers for Disease Control saying that there are some people who believe that the COVID-19 vaccine is less safe than other vaccines.
Well, if you look at all the data in terms of the scientific approach to produce this vaccine, nothing actually was left behind. They followed the same protocols, the three major phases, and then large human trials also were also done. And a lot of people are worried that normally the previous vaccines we had in the past took years, some almost 10 years. If you remember the smallpox vaccine, Nigeria was one of the major players in eradicating smallpox in the world. It was produced, most of them was produced from VOM, where we have the virology unit in Jos. For this particular vaccine, they followed all the protocols. I don't see anything that will be different from other vaccines we have been applied, and no data has actually shown that there is a different thing happening compared to what has been happening before.
What advice would you give to pregnant women, families who plan to have more children, trying to overcome fertility delays? Is the vaccine safe?
Well, most of the vaccine trials, I don't think any of them has been done in pregnant women. There are some companies who are trying to start to do it now. So there's no data really for pregnant women. So I don't think I will be in a good place to advise people to take it or not to take it. But I think it's the attending physician will probably look at the risks and the benefits and then make a decision. But most of the trials that have been done have not actually been done in pregnant women. So there isn't any data as such, as I know, that will be used to be able to make such definitive decisions when it comes to pregnancy and infertility. Well, for people who are infertile, I don't see how the vaccine will affect their fertility. I know there are some conspiracy theories out there saying that this might be a way to introduce this, and those are all, they remain what they are, conspiracy theories. There's no fact behind those things.
And finally, do you see that, immunity lead to the eradication of the coronavirus?
Yes, I think that is what the world is trying to attain. By the time the world gets up to 70% of the vulnerable population, and then we'll tend to get herd immunity. That's actually how most viral infections are eradicated. Once we get to that herd immunity level, and then even though it's still too early to talk about how long the effect of this vaccine in terms of providing safety and protection, but all the same, I think it's a lot better than nothing. And once we get to the critical population size in terms of numbers, about 70 or slightly more than 70%, the world will get herd immunity. And once we have that herd immunity, that means humans will not be able to transmit to each other, and that will be the end of the pandemic. So I'm very, very hopeful, and strongly so, that the world will attain herd immunity the way they are rolling out the vaccines. One area that I have been so worried as a rights activist is the issue of equity in the vaccine distribution. But people will always say you have to treat your people first before you help others. And that's why I'm quite excited that the COVAX, making sure that this vaccine goes to low and middle income countries, that they'll be able to get at least 2.2 billion doses out there to satisfy the rest of the world that do not have the purchasing power of the rich nations. It's just a matter of time. So we're hopeful that this will make sure that every person that should be vaccinated on the planet is vaccinated, because we live in the same ecosystem. If you are so rich in one place and you do everything and you leave the other place, they'll come back and reinfect you in the future.
All right.
So I'm glad that this is going on well and it's happening.
We'd like to thank you. We appreciate your time on the program. Dr. Ejike Orji, Chairman, Medical Subcommittee of the FCT's Ministerial Expert Advisory Committee on COVID-19. Thank you for joining us.
Thank you, Millicent, for having me.
Now, Kenya on Wednesday recorded the highest number of COVID-19 infections since last year. The country's health minister says Kenya is officially in its third wave of the outbreak, with 713 more people contracting the virus over the last 24 hours, out of the sample size of 5,230 people tested for the disease. Dr. Mutahi Kagwe noted that the new numbers are alarming. The health minister also announced that together with the Council of Governors and other officials, they will debate today whether to increase or reduce measures to fight the virus. Well, don't forget to protect yourself. Wear a face mask in public places. Continue to wash your hands and observe the other protocols. For more updates, also a better understanding of the pandemic, take a look at our website. It will show you more of the stories there. That's channelstv.com. You can find several other stories as well in business, politics, sports, and other news. That's the program this evening. Thank you for watching. I'm Millicent Nwoka. Stay healthy.